Hello, it's Dr. Rhonda Johnson. Today is Wednesday, September 29th, 2021, and today I'm going to be discussing long haulers. A recently published study showed that 1 in every 3 COVID-19 persons who are infected with this virus become long haulers. Now, long haulers are not people who drive trucks. They are people who survive COVID-19. And long haulers can be people who only had mild illness. Now, this recent study that I cited that said 1 out of 3 people who survived COVID, this study was done by American and British researchers. And what's significant about it is the number of charts that they reviewed. They looked at electronic health records from more than 270,000 Americans who were recovering from COVID. And again, the researchers found that 37% of these COVID survivors here in the United States experienced at least one symptom between 3 to 6 months after their initial diagnosis. Now, in this study, anxiety or depression was the number 1 complaint, followed by abnormal breathing, abdominal symptoms, and fatigue. Now, some of you may be wondering, how on earth do COVID patients end up with impaired brain health? Just remember that the virus comes in and attacks through the nose, and the nose is a part of the brain, and this can account for the brain-related findings. Also keep in mind is that the Delta variant, people with the Delta variant can have more than 1,000 times the amount of the original strain, or even the Alpha variant. They can carry more than 1,000 times of this virus in their nose. Now, other symptoms that many long haulers suffer with include prolonged shortness of breath, even when their oxygen levels are normal. Many have irregular heartbeats. Some suffer from muscle weakness and muscle fatigue. Others have chronic headaches, clogged ears, changes to their skin and scalp, dizziness, difficulty concentrating, memory loss, chronic loss of smell, and changed sense of taste. How long these symptoms last, it can vary. Some people have them for a long time. Some people have them for a short time. And the mechanisms of this are not really understood. Now, long haul symptoms have been reported in virtually every age group, including children. And a significant number of men, a significant percentage of men, will experience swelling of their testicles, erectile dysfunction, and low sperm counts after COVID infection. Now, again, what's believed to be involved here is this damage to the lining of the blood vessels. Our blood vessels carry blood and life-sustaining oxygen to every organ, every tissue, every cell in our body. And when they're disrupted, it causes significant concerns. Now, experts say that it can take up to 6 months for people who have impaired lung function as part of their long haul symptoms to return to normal. And so folks may want to get some respiratory therapy and do some breathing exercises to help with that. You know, it is so important to have a relationship with a healthcare provider before you get COVID, during COVID, and certainly after COVID. And for people who lack health insurance, there are federally qualified health centers that offer reduced pay or no pay depending on your income. That's called like a sliding scale. What you pay depends on what you earn and make. So, folks, we have to remember that death from COVID is not the only thing that counts. We have to also count lives changed for a long time. You've heard the saying that an ounce of prevention is worth a pound of cure. And you've heard me say many times, the best COVID infection is the one you never have. So please, forget all that misinformation out there. Get the COVID vaccine and practice the layers. Masking when you're out in public, even if you're fully vaccinated. Safe distancing. Keep that ventilation. Be mindful of places that are poorly ventilated. And wash your hands often. Again, even if you're fully vaccinated. That's my message today. As always, my views are my own. This is Dr. Rhonda Johnson. Stay safe, folks. Do everything you can to prevent COVID infection. And as always, have a blessed day.